Welcome everyone. Thank you all for joining us. It's great to see so many familiar faces. Don't be shy about turning your cameras on. For those of you that don't know me, my name is Christy San George, and I'm very proud to be the practice administrator of Miami Plastic Surgery for the last 13 years. I'm really excited about this live event, so let's get started. I want to thank you all again for being with us this evening. We really appreciate you taking the time out of your day to join us and to learn about facelifts in 2021. What is different? Our speaker tonight is Dr. Michael Kelly. Dr. Kelly is double board certified in both general surgery as well as plastic and reconstructive surgery. He has been recognized as one of the top plastic surgeons in the country every year for the last 20 years. He's also recognized for his extensive experience in facial plastic surgery, and we couldn't be happier to have him with us speaking this evening. After the presentation, you all will have the opportunity to ask questions, so make sure to stick around. We will also be offering a giveaway of some amazing SkinCeuticals skincare products. That's my favorite part. Dr. Kelly, please join us.
Thanks, Christy. Glad everybody's here. We're gonna have fun tonight. I even saw Aunt Nancy is here. Hi, Aunt Nancy. So we're going to talk about what's new in face and neck lifts in 2021. And let's go ahead and get started with that. So are there really facelift techniques that are new? Absolutely. We're constantly evolving. And really, if you want a great result in 2021, you need to understand what we have learned about aging in the past 20 years. Tonight's program and what I'm going to talk about are how the face ages, techniques that are used to correct facial aging, newer enhancements to surgery that make recovery easier and faster, and examples of patients I've treated, what their problems were, and then how we got them to the result that they got. And afterwards, we'll have a little Q&A session where you can ask me questions. And after that, we'll have our little quiz where you can actually win some SkinCeutical products. So what happens when we age? Well, this slide just kind of summarizes what we see with patients. This is a mother-daughter combo, and you can see the fullness of youth in the younger patient and see how her face is full and her jawline is smooth. And look what's happened to her mom through the years. The face has deflated, the jowl has descended, her neck has become lax, and there really is a generation. They're about 25 years apart. So you get a sense of the overview of what happens. It's not pretty. And so to make our face and neck lifts better, you really need to understand three important aspects of facial and neck aging. The first, and what I think is probably the most important aspect, is that most facial aging is due to fat loss. And what you'll see in this series of faces is that for the 35-year-old, their face is plump, they've got good fat there, their jawline is smooth. By 45, they're losing fat in their face, they're deflating, things are starting to descend a little bit. And by 55, a lot of that fat is gone. And the jowl has gotten bigger, and it's fallen down below the jawline. So you can see how all these surface aspects that we see of aging really have an anatomic basis underneath it, and you've got to fix that to make people look young again. The second part after fat loss is that the jowls descend, and they actually get a little bit bigger as we get older. And going back to that 55-year-old patient, you can see how along her jawline now, she's got the jowl there, and that jowl is filled with fat that's fallen down below the jawline and has created that bulge. The final aspect of facial aging, which I find is to be the most important, is that the platysma muscle starts to descend. And the platysma muscle is this large flat muscle located right under the skin in the neck. And what happens is it falls down as we get older, and it accompanies the descent of the skin as well. And in that next picture there, you can see how you get a preview of how we fix it by using sutures to pull it back up again. How do we fix these three things? Let's talk about, since we understand now those three things that cause the aged look, how do we fix those things? And so the most obvious way to fix a loss of facial fat is to put fat back. And we do fat grafting. Fat grafting is a technique where we take fat, usually from the tummy, we centrifuge that fat, and we get rid of the blood and the serum, and then we re-inject that fat in the areas of fat loss, just like you would do with a filler, like Juvederm or Voluma, but we're using the best filler, which is your own fat. Here's a picture of a patient whose only problem is facial fat loss, and you can see highlighted the areas where fat grafting was done, and then you can see her results, which really just took her deflated face and put it back to where it used to be when she was younger. And just you can see this effect from just fat grafting alone. We deal with the jowl enlargement and the descent of the jowl through liposuction. And what I do is I take a very small cannula, it's only 2 millimeters wide, and we remove the fat from that jowl. So now when you see that jowl in the before picture here, you can imagine that it's just filled with fat there. And by taking that fat out, we allow that jowl to shrink and we make the jawline smooth again. Finally, the descent of the platysma muscle is really what determines the shape of the neck. And I find for most of my patients, getting their neck back to normal again is one of their most important priorities. So we do this posterior platysma tightening. And again, as I showed you in the slide earlier, you can see how the neck has fallen in the first slide, and then how we use sutures to bring that platysma muscle back up. And give you a preview of treatment. Here's a patient whose platysma muscle is going straight down from her chin to her thyroid cartilage. It's a straight line, and it looks like that before picture in the diagram. And then after, we've brought that muscle back up, and you can see how we've created a nice profile that looks like the diagram that I showed you. So in addition to the surgery, there's also things we've done to make surgery, the recovery from surgery, easier and faster for patients. And one of them is called fibrin glue, which is a spray that I use during surgery, which stops bleeding, and thus patients get much less bruising. And also eliminates the need for any drains after surgery because it seals the tissue back together again. So I haven't used drains for over 10 years. My patients do great, but patients hate drains. Many plastic surgeons still use drains, and it's just an unnecessary inconvenience for the patient that my patients don't have to go through. Another product that I use is called TXA, or tranexamic acid, and we learned about this from the heart surgeons and the orthopedic surgeons. It's a drug that's given before surgery in your IV, and it too cuts down on bleeding and bruising. And so the patient doesn't have to do anything, they just get this in their IV. Here's a patient literally the day after surgery when we use fibrin glue and TXA, and she's got almost no bruising whatsoever. And this is not unusual. In my practice, this is a typical appearance of a patient's neck once I've used fibrin glue or TXA. Now, the areas where I do fat grafting, or if I do someone's eyelids, or in the areas of liposuction, we can't use the fibrin glue in those areas, so people can still get bruised. But it's reduced the amount of bruising that we see dramatically. And most of my patients, I tell them, within 7 to 10 days, all of your bruising should be gone. It's very unusual for someone to have bruising beyond that period. The last thing I think really helps people get over the surgery faster is that we've eliminated the need for an incision under the chin, because I only do the muscle tightening now through what's called a posterior approach. And this slide on the right will show you how people talk about making an incision under the chin. And a lot of facelift and neck lift surgeons still make that incision. I used to make that incision for many years. I've gotten away from it now because I can get a better muscle tightening from the back. But also, since I don't open up that incision, I don't open up this plane under the chin, there's not the inflammation and recovery for that area. So patients get better faster. They look better in the front, which is the most important area to them, and the areas of the incisions are hidden behind their hair. So what I've learned from all of this is that many patients don't even need a facelift. most of them really can be improved just with a neck lift and with fat grafting. And we don't need to really tug on the skin of the face to make them look better. We need to give them volume back in the face, and then we need to tighten the skin and the muscles of the neck. But that allows me to avoid incisions in front of the ear and again, speed the patient's recovery. When using that approach, all of our incisions are hidden behind the ear. So I want to go on now and show you some examples of patients. And what I'll do is show you the before picture, and we'll talk about, and you'll be able to see now after we've kind of explained what happens anatomically with aging, and then how we fix it, and you'll see the after results. So this is a patient. The first thing you think when you look at her patient with her face is she's deflated. Her whole face is deflated inward because she's lost so much fat. She just looks tired and aged from that loss of fat. And in her case, she also has some jowling and also loss of fat just in front of the jowl. And with fat grafting and a neck lift, here's her result. So you can see the rejuvenation we can get without doing a facelift, just doing fat grafting and a neck lift. Another patient, younger patient, similar problems. Now she also has excess skin in her upper eyelids, which we fixed as well. But if you concentrate on her face, you can see that she's lost fat in her face. She's developing a jowl along her jawline and lost fat just in front of that jowl. And after doing her eyelids, fat grafting, and a neck lift, this is her result. And she's been made rejuvenated. She looks like herself, but she feels like she's 10 years younger because now her jawline's smooth. She's gotten the fullness back in her cheeks, and her eyes don't have that heavy hooded appearance. Same patient, just to show you her jawline again. Here you can really see the jowling. You can also see the loss of fat just in front of the jowl. And if you look at her cheek on the far side, you can see how that cheek just comes straight down. She's lost the fullness of her cheek. And the best view of that is this 3/4 view where you can see her left cheek. And then once we've corrected her, now you can see how we've restored the nice natural curve to her left cheek. We've restored her jawline. We've taken down the jowl. We've filled in the areas of fat loss. And you can see how pretty her eyes are as well. A heavier, older patient, more challenging, but the same problems. She also had heavy eyelids, which we fixed. She had loss of fat. Even though she's heavy, she has loss of fat in her cheeks. And she's got a little extra fat in her neck that I need to remove as well. But here you can see her, again, after a neck lift with some fat removal in the neck as well, fat grafting to her cheeks, and we did her upper and lower eyelids as well. And if you see the same patient from the 3/4 view, you can see how she has really no definition of her jawline. She has the excess fat under her chin, and she still has loss of fat in her cheeks with the fat bags under her eyelids and the excess skin above her eyelids. And here's her result after surgery. And you can really get a feel for how rejuvenated she is. She has a jawline now. She's got the fullness back in her cheeks where she needs it, and her eyelids have been treated as well. Finally, a very pretty patient who's lost fat in her face as she's gotten older. Again, she's got the jowling, the loss of fat in front of the jowl. I did her eyelids many years ago, so her eyelids don't need to be done. And then her neck is just driving her crazy because she's got excess skin and the descent of the muscles in her neck. And this is after we've done the same procedure, a neck lift, fat grafting to her face, and taking down the jowl, filling in front of the jowl, and she's got a nice smooth result. And I think from this picture, you can see her before, and you can see how happy she is, having corrected all these problems. So that really finishes my before and after, and I think everyone can see now and understand now the problems of aging and how we fix that. Let me just summarize that face and neck lifts are much better in 2021. And this is due to the fact that we just understand aging much better, even compared with 10 years ago. I understand what's causing the face to age, and we're making our treatments fix that. our procedures are less invasive now, and they're done with less scarring, which is what patients want. And they produce natural results. You don't see any of those patients look pulled. They all look natural because we're not focusing on just muscle tightening and skin tightening. We're giving them volume back, which is the primary problem in facial aging. One compliment that all of these patients will tell me is that I look like myself, I just look refreshed, and that was my biggest fear. And finally, they're associated with an easier recovery and less bruising because of the TXA and the fibrin group. So Christy, if you could join me.
Yes, thank you. It is now time for our question and answer session. For those of you that have your cameras on, if you can just raise your hand, give us just a moment to unmute you, and Dr. Kelly will answer your questions. So Dr. Kelly, help me look. I do need glasses and I don't have them on. If anyone has a question, just raise your hand.
Sarah Fortes looked like she was raising her hand.
Okay, Sarah, give us just a moment to unmute you.
Hello, can you hear me?
Yes, Amy, how are you?
Doing good, how are you? Thank you for this informative session, really appreciate it.
Sure.
My question is, what is the average cost of doing all this that you're talking about?
Well, it's a range depending on how much we have to do. And when I give you these numbers, it depends on whether we're doing just the neck lift or the facelift alone. But most patients, it's going to start probably around $12,000 and go up to $15,000, $16,000, depending on how extensive things are. Also, if we have to do eyelids, those can increase costs as well. Once I have a consult with you and I see what you need as in specifics, then my assistant Aurelis can give you the exact breakdown. And she tells me never talk about price because I'm the worst about that. But that gives you a ballpark idea.
Thank you. My second question is, do you have to stay overnight for the procedure or is it outpatient?
It's an outpatient surgery. We do it in my office operating room at Baptist Hospital. We use the anesthesiologist from the hospital who come over and give you anesthesia. They're all board certified. After surgery, you stay in our recovery room for about 2 hours. Once you're completely awake, you go home. That night, I have you sleep with your back elevated. I always call that the patients that night to check on them. And then we see you back here, which is my South Miami office, the day after surgery, and give you all of your instructions. But it is an outpatient surgery.
Great, thank you so much.
Good.
And before we go on to the next question, I do feel like I want to put a little plug in here and let you know that our office does offer several financing options. And when you come in for consult and see Dr. Kelly and speak to his patient coordinator, they can review all of that with you. So let's look and see who the next person is, and we can go back and, are we able to unmute Sarah? Sarah Fortes? Sarah, I'm so sorry, it's still stuck. We can't unmute you. We'll try to come back.
We have a chat from Laura.
Okay.
And Laura wanted to know, does the procedure experience pain afterwards? If so, how long are you down? That's a great question. One of the best parts of this surgery is it really doesn't hurt. And the vast majority of my patients just take Tylenol after surgery. And if they take that, it's usually just the first night. Now we give you stronger pain medicine, but hardly anyone ever takes it because it's just not a painful surgery. The worst part of the surgery really isn't pain. The worst part is that you'll still get some bruising and it may take a week for that bruising to go away. But I tell people they're going to feel okay the next day.
Second to unmute you. And go ahead, Christine, what's your question?
Great, yeah, I think I'm unmuted. Doctor, I'm just kind of curious, and you talked a lot about the fat transfer. How long does that typically last?
That's a great question and one that I get all the time. I think that the fat that I transfer from your tummy to your face will be there forever. It'll be there forever. It's literally a graft. It lives in its new position there. And if I go back and I do surgery on someone 5 years later, I can still see that fat there. I can tell it different from the native fat that's there. But I also tell patients that all we're doing is we're setting back the clock and we're not stopping time from happening. So over time, you will continue to lose the native fat of your face as part of the aging process. One of the nice things about using fat now, though, is that I think when you see these patients who had like 2 and 3 facelifts many years ago, that was the only tool that plastic surgeons had. So when someone would come back 5 years, 7 years after a facelift, they just tighten them further. And it just made people look unnatural. Now, when I see patients where I've done their facelift and it's been 7 years and they're thinking, you know, I just want to refresh things. Most of those patients just need more volume. What they don't need is another full facelift again, because that's going to make them look unnatural. But if we can put some more fat back there to replace the additional fat they've lost from their natural aging process in their face, that will be a good thing for them.
Great, thank you.
Sure.
Okay, so we're going to look for another hand raised here. Give us just a moment to unmute you. Okay, go ahead, Jeff. What's your question?
So I'm assuming that these procedures aren't any different for men or women, number one.
They're not. Sometimes we change the scar placement a little bit for men, and men have a more vigorous blood supply. Men have thicker tissues. So sometimes the results aren't quite as dramatic as men as they are in women, but in general, they're very similar.
And I would be coming from out of town. What is the normal recuperative process?
Yeah,
I know you said we see you the day after, but then
normally I like people to stay about 7 to 10 days after surgery. Usually by 10 days, you're going to be fine to go home. Sometimes earlier than that, depending on how you're healing. We get patients from all over the world, so we're pretty set up to have patients do that. There's a hospital, there's a hotel, a Hilton, right on the hospital campus there. So it makes it very convenient. You usually will come in the night before. We'll go over things with you, do the surgery the next morning, and then we'll see you during that week, usually 3 or 4 times before you go back. After you go home, we can handle everything just like this over the internet. It's amazing now. And my nurses can talk to you. You can send us pictures if you have any question about something. All the stitches that we're using are dissolvable stitches at that point, so that we don't have to worry about taking out stitches later.
Perfect. Thank you so much.
Okay, so we're going to take a look at the chat. I see that it's filling up with some questions. Do you need to wear a garment after surgery, Dr. Kelly?
You don't need to wear a garment. We do have you wear a head wrap that first night, so that you really don't have to do anything. It's just basically an elastic band, an ACE wrap. And then we see you the next morning. We take that ACE wrap down and we give you an elastic band, which you wear all the time for 3 days after surgery. And then the next 3 days after that, you wear it at night. So by a week after surgery, you're not wearing any garments or any compression devices.
Let's look for one more question. Is the neck lift done with general or local anesthesia?
The neck lift is almost always done with general anesthesia, because when I do that posterior approach, I actually go under the platysma muscle, and that's where all of the branches of the facial nerve live. And I can't have you move a millimeter because we want to protect the facial nerve. So fortunately, there's 25 anesthesiologists at Baptist Hospital. I only use the 10 which are really the best and who are experts in cosmetic surgery. We never see vomiting. We never see problems with anesthesia. Knock on wood, I've never called 911 from my office. These patients do great. They won't let me operate on somebody who's not a good candidate for surgery. So it's very safe, but for your safety, I do it under general anesthesia because that's the safest approach, both from an anesthesia standpoint and also from a surgical standpoint.
There's another question here, Dr. Kelly. Is there any difference for dark skin? We have a patient that's worried about scarring and or hyperpigmentation.
Sure. In general, most patients are going to be able to have this surgery no matter how dark their skin is. The best predictor of what your scarring might be like would be if you have another scar somewhere on your body. If you're someone who's prone to bad scarring, you're going to be more at risk for that with a neck lift surgery. However, the face generally will heal much better than other parts of the body because there's a better blood supply there. And because we're hiding the scars behind the ear, even if you had a bad scar, most women are going to be able to cover that with their hair. very rare for me to see people with bad scarring. It's just not that common of a problem.
I'm learning so much throughout this. I love this. Okay, let's get another question here. We have Analita. We're going to unmute you and go ahead and ask your question.
Hey, everybody. Thank you so much for doing this. I have a quick 2 questions. If I take like the arnica pills before, will that help possibly with bruising? That's
100%.
the first question. Go ahead.
100%. I encourage people to do that. I don't think arnica is as strong as the fibrin glue or the TXA, but every little bit helps.
That's what I would think. Every little bit would help. And then this area here, if this is a little slack, when you do this, will this help tighten up some of this here as well?
It does help that area. Now, sometimes patients start getting areas even down under their chest that they want me to improve just from the neck incision. That's not going to happen, right? So we're really limited to the neck.
Over to the chat for a minute. I see it's filling up with more questions. How long is the surgery?
Surgery for a neck lift with fat grafting takes me about 2.5 hours from the time I start doing surgery, okay? Now there's probably a half hour or 45 minutes where they're getting the patient ready for surgery, and then we have wake up time after we're done. But for me, where I'm actually doing surgery, it's about 2.5 hours.
And I see another question. Is it possible to do an appointment online? I am out of the USA.
Yes, we have that opportunity for patients.
Yep, we can always do a virtual consult. Let me see. Is this called lower face surgery? What does that include? Jowls, neck, and what else?
Yeah, it's exactly what it is. We call it a neck surgery just to differentiate it from a facelift. But as you saw in all those patients, they all get a lower facelift too, because we're improving their jawline, we're taking care of the jowl. So all that is really included in just the neck lift. With the neck lift, then I usually add fat grafting, which is a separate procedure to give volume back to the face. So a lot of times we're doing a neck lift with facial fat grafting. The times where I think about doing a facelift too would be when the patient literally has excess skin in their face. When we start seeing them looking like there's just a lot of excess skin there, then that's when we consider extending that incision up into the front part of the ear to allow me to tighten things in the face itself. But I tell you, that's probably 10 to 15% of my total patients now. Most facial aging occurs centrally. Tightening the skin up here by your ear doesn't really help what's going on in the central face. So again, the fat grafting, 10 times more important than any facial skin tightening.
And I saw a question before, Dr. Kelly. How soon after surgery can they resume regular exercise?
Usually 3 weeks. And the reason I have them wait is because they're swollen initially, and we want that swelling to go away. So we don't want you doing anything that's going to raise your blood pressure, increase the blood flow to your face, because it's going to make it take longer for you to get better, for you to look good. After 3 weeks, I tell patients they can pretty much do any activity they want. The only other caution between 3 weeks and 6 weeks is sun exposure. I don't want you to go to the beach and get sun exposure, especially without sunblock or a hat, because then you can develop hyperpigmentation problems because the skin is still very sensitive, having just had surgery before. So we have to protect you from the skin. After 6 weeks, you're pretty much free to do anything.
So yes.
There's lots of good questions here. I saw someone who said, I have 2 cords on my neck. Is that something that can be taken care of with Botox instead of surgery? It absolutely can be treated with Botox. My frustration with Botox in the neck is that it'll work. It'll treat a cord, but at most it's going to last 3 months. And it takes at least a cc of Botox, sometimes more than that, to get that effect. So someone's coming back 4 times a year to get Botox in their neck, whereas with 2.5 hours of surgery, I can fix their neck and have it be a lasting result. Probably you're going to spend as much money doing Botox over the next 5 years.
Good point.
And not have nearly as good a result as if you'd just done surgery in the first place. But listen, we want to treat everything with injectables. One of my colleagues said, he goes, I treat their faces with injectables until they can't stand their neck anymore. And that's when it's time to do surgery. So, case.
Question.
Oh, great question. Do you recommend PDO threads for less invasive procedure? my answer to that, and other people disagree with me, my answer is absolutely not. I found that the PDO threads do minimal improvement. They hurt, and whatever improvement they make is usually gone within 3 to 6 months. They're expensive, and to me, it's something that is just not, is again, people are looking for that less invasive option, but they're not going to get the result that they want. And I don't encourage that. And I don't do the procedure, even though I do a lot of non-invasive procedures. That's one that I tried, and it was just, no, it didn't create any positive improvement for the patient.
Thank you all again for joining us. We can't wait to host more of these in the future, and we hope that you continue joining us. If you're interested in booking an appointment with Dr. Michael Kelly, please follow the link that we have attached in the chat box. And we will also be sending you an email with some additional information about Dr. Kelly and all of the services that he provides.
If for some reason you can't reach us through these methods, call the office, 305-595-2969, make an appointment. I've got to really see you in person for the best approach to really tell you what you need as an individual, and then you can meet the staff and we can get you on the path to a new you in 2021.
Yes, and to our current patients, we have a new phone system, so you should be able to get right through when you call. If not, you can always send an email to info@miamiplasticsurgery.com, and I personally get all of those, and I will make sure that that is forwarded to his patient coordinator, Aurelis, and we will get you scheduled to come and see us. Thanks again, and have a wonderful evening to all of you.
Thank you, everyone.